My name is Jonathan Weisswasser. I'm a vascular surgeon with the Aesthetic Vascular Associates. Spider veins are those very delicate purple, sometimes pinkish veins that almost look like a starburst on someone's legs. Spider veins rarely cause any symptoms. Occasionally, people will have problems when they're shaving, for example. They might nick one and it'll bleed excessively, but really by and large, they are completely asymptomatic. The treatment of spider veins uses a technique called sclerotherapy, which is a big fancy word, literally means shutting down a vein. So my practice is really focused on the use of injection sclerotherapy. I use something called a sclera over multiple sessions using the smallest needle that we have. I go through and inject as many of these spider veins as I can, either until I run out of ones to inject or I hit the maximum dose that I can administer. Just about anybody is a candidate for the treatment of spider veins with sclerotherapy. The only caveat really is somebody who's had it in the past who may have had a reaction to it. That's obviously something that we would have to consider before that. The other thing that I like to do is I encourage people to have their treatments done in the late fall when they're changing their wardrobe. Just because there's some discoloration associated with sclerotherapy, and I wouldn't want that to interfere with their summer activities when they're like on the beach or just wearing shorts. Each treatment takes about 20 minutes. My nurse says that it's like being nibbled to death by ducks. It's just a bunch of little tiny needle sticks. If you've had a TB test, for example, imagine having 20 of those. I don't stop doing the sclerotherapy treatments until my patients are happy. I basically leave it to them to decide when they're done. And I find that that works very well as far as patient satisfaction. So my goal is that somebody coming to me for the treatment of their spider veins feels at the end of the treatment that they really have a significant difference in the quality, the cosmetic quality of their legs, and they're happy. So in the short term, that's my goal. In the long term, unfortunately, I'm unable to prevent them from reoccurring. And it's very common for them to reoccur. And so I tend to advise my patients that it's not unusual to see the redevelopment of spider veins in, say 3 to 6 years down the road, in which case they just come back to me and it's usually just a touch up or two to really get rid of them.